Hello. In today's episode, I asked Professor Mary-Louise McLaws whether hand hygiene and personal protective equipment is protecting frontline clinicians and when she thinks that the COVID-19 pandemic might actually end. I think I probably know the answer, but what do you think of the emphasis on hand hygiene and on PPE? And that obviously as clinicians we're being advised strongly to use. What do you think of the notion that that's our principal means of protecting ourselves from infection?
So, we know that the medical profession are not very good at hand hygiene. So they're, like all professions, nursing, allied health and medical, you're very good at hand hygiene after you've touched the patient, but the patient can be at risk from you as well. So we do know that healthcare workers are also at great risk from any droplet spread disease. And it's because it requires fabulous environmental cleaning because your hand hygiene isn't that good. And you do touch your face 23 times an hour because my 2 PhD students and I did the study. It's the only one in the world at the moment. And of those 23 touches per hour, you touch your mucous membranes of your face either singularly or in combination 11 times an hour. So don't touch your face if you haven't hand hygiene properly. So hand hygiene is an important element, but it's only one. Environmental cleaning in the hospital of high-touch areas is important, but it's only one. And all of those, that has to be bundled with, do you protect your mouth and your nose with a mask? What type of mask? And do you protect yourself with a face shield or goggles? So the WHO and the Clinical Excellence Commission and all other departments of health will have put out protocols saying that you really only need to protect yourself if your patient is coughing. And then the patient should wear a mask. The problem is, as you know, patients suffer a lot of anxiety when they're coughing and trying to gain breath from wearing a mask. And if they do have COVID-19, as you well know, they don't even sometimes realize that they're having trouble getting oxygen in, let alone putting a barrier in front of their face. So a mask would probably be a good idea. And a surgical mask is very, very effective. Of course, if you're having to get up close and personal to intubate, you need to wear a face shield or goggles. And I would prefer a face shield because it also protects that outside of your mask. And we do know, when I was looking at how healthcare workers were getting SARS at the designated hospital in Hong Kong, they had several different peaks of how healthcare workers got it. The first one was they rushed in to save the patient and intubated them before they put their own mask on. Then the next one was the Amoy Garden, and they were probably a bit taken aback with the uncontrolled diarrhea. It was really bad. And then the next wave was, after talking to them, probably a fatigue of their PPE, and they were touching their face, but they were wearing PPE. So we can only assume that it was the touching and the fiddling because they were over hot. And you should not be wearing that for longer than a few hours a day because it's the anxiety, it's the sweating, it's everything. How long will it go on for? So seriously, in Australia, we need to lock down our borders until it's under control in the Northern Hemisphere because we humans are interconnected and we love travel, as we've seen by the cruise ships and the aeroplanes bringing in cases into the country. So we can't loosen up the borders until it has ended in the Northern Hemisphere and until they go into summer. Now, that same famous virologist had written a lab paper on SARS 2003. It was a lab paper. It wasn't in humans. But if you look at the epidemiological curve of SARS in 2003, in both China and Hong Kong, it of course reached a peak and then it decayed and then it tailored out, and there was a huge amount of effort for infection prevention and control. And by May, end of May, it was called the end. And guess what they were going into? Summer. So then this clever virologist went into the lab and tested SARS-CoV-1 in the lab, and tested it against 20 degrees C at 50% relative humidity. Then he increased it to 24 and 28%, 28 degrees C, and increased the relative humidity to 80%. And the log reduction was dramatic. This virus, or SARS-CoV-1, did not like heat or relative humidity. So we do know that many of these viruses don't like humidity and temperature. Humidity either because it's very cold and it kind of freezes them, or it doesn't help to spread. So it gets into the humidity, it falls rapidly, and it doesn't hang in around. So let's hope that we will go, the Northern Hemisphere, going into summer with hopefully many of their countries really doing their humanitarian requirement, and that is fighting this disease, and doing it fast, will decrease the numbers, and then Mother Nature will take over a bit, because we can't loosen up our borders. Otherwise, it'll just be a boomerang constantly.